Hello, I'd like to welcome you to the Exploring Resilience Through an Introduction to Resilient Communities panel today. My name is Mevin Boyd, and I'm the Resilient Communities Officer with the North Carolina Partnership for Children. What I'd like to do before we get started is to give you a brief introduction to the North Carolina Healthy and Resilient Communities Initiative that is hosted at North Carolina Partnership for Children, and then turn it over to our panelists to introduce themselves. The initiative that I am a part of, called the North Carolina Healthy and Resilient Communities Initiative, has three goals. One is to look at creating a unifying framework for the many initiatives working across our state to address childhood adversity and to find protective factors and build resilience efforts. Is how do we align and work together in the same direction? The second goal is to understand better and to define and identify what makes these coalitions, this work across multi-sector collaboratives, task forces, what makes them successful, so that we can share what works to others who are working in this same field. And finally, to co-create supports that local systems change organizations need. And the work that we do is guided by, informed by, and done in collaboration with the many great folks doing this hard work on the ground across our state. And I'm grateful for all the folks who are involved together with us as we co-create these supports. The next slide that I'm going to share is a theory of change model that we are using to help align our work. And I'm not going to spend a lot of time on this, but am happy to explain or have conversations with anyone who's interested in learning more about this theory of change model. But basically, it starts with the how we do the work, the community values that are so important to establish by these local coalitions. These come from SAMHSA, the Substance Abuse and Mental Health Services Agency, as the 6 principles of a trauma-informed community. And it is just as important that we spend time on creating the community values, the community culture of our work, as it is to do the work itself. The orange-brown color are the broad strategies that come from the ABLE theory of change, which tells us that we have to work on, if we're really going to create systems change, that we can't just focus on 1 or 2 of these different broad strategies, that all of them are necessary in order to accomplish the big change that we're after. The green and the blue, finally, are what we want to get to as a result of our work. So the community conditions, reduced ACEs, better social connections, trust in leadership, collective empowerment, better economic development, we believe will result in the larger population results of community connectivity, safe and secure places, equitable opportunity, and then ultimately healthy and resilient communities for all children and families. That's happening, of the work that is happening in our state. And probably one of the most important things to know about this map is that for a county to be filled in itself, it needs to answer yes to all the questions that are in the big orange box on the left. So does your county have a multi-sector? That means you're represented by different systems. For example, not just early childhood, but law enforcement, K-12 education, healthcare, mental health, the arts community, the faith community. Do you have multi-sectors at the table? Do you have groups that are, does that group focus on ACEs and resilience? And is that group meeting regularly? The other item that's not in that orange box is that many of these counties that are filled in orange are working across the lifespan So early childhood is at the table perhaps, but it doesn't stop at early childhood, that it looks at a person's life and building resilience from birth to the end of life. That it's a lifespan effort for many of these counties' initiatives. So wanted to share this map with you. We won't look at it in detail, but I welcome your feedback. You're helping me keep this updated so that we know what's going on in North Carolina. And I'm so proud to be a part of this state that has so much going on in this field. And with that as an introduction, I am going to turn it over to our panelists to introduce themselves and give some basic information about the coalition. Sometimes it's called a task force, sometimes it's called a collaborative, this multi-sector group that's in their community that they are a part of. And the first one is Tamara. Go ahead, and if you could introduce yourself and give us also some wins, a couple, one or two things that you're most proud of that has happened in your community around ACEs and resilience.
Okay, can everyone hear me okay? Perfect. So welcome everyone, and thank you for joining us today. So my name is Tamara Church. I wear many hats. I'm a faculty member at East Carolina University. I am also the Talk It Out ambassador for the Eastern region of North Carolina. But then I also lead the Coastal Coalition for Substance Abuse Prevention, otherwise known as CSAP. We recently, I guess our big win, I need to take a step back and share, 2 years ago, we had received funding from the Blue Cross Blue Shield Foundation. There were 3 counties across the state that were awarded this grant. And it allowed us to actually create and build a resilience collaborative in Jones County for 2 years. From that, once those funds were exhausted, we recognized that there was a greater need in the larger community. And being that I oversee the CSAP, which is a 5-county coalition, we decided to bring that collaborative underneath the nonprofit of CSAP and allowed ourselves to expand to 5 counties. So we cover Carteret, Craven, Jones, Onslow, and Pamlico counties. And so unfortunately, it's almost like we're taking a little bit of a step back right now because we had all learned and moved together over the last 2 years. Now we have a lot of new people come to the table, but it's been a great opportunity, I believe, for all of us to kind of take some of those leadership roles and to share our own knowledge within our group. It has also challenged us to really think about, the need to make sure that whenever people first join, that they understand and kind of have that onboarding process too. So it's been a great learning opportunity for us. Our other win is that we partnered with CSAP and held the 2021 Resilience Symposium. And so that was right before we ended up pulling them underneath our coalition catchment area. And so we are excited to share that we are planning for the next one. So I would say that those have been our 2 biggest wins. The need to bring it underneath the 5-county. We are funded by the Drug-Free Communities Grant. And so if anybody on here has that grant, then and if you don't, then I'm about to tell you, you can use those grant funds and those dollars to address ACEs and build resilience. So it made sense for us to bring that underneath our larger coalition for sustainability purposes to continue to be able to do this work while we also seek other funding sources. So we are a nonprofit. We have been a nonprofit since 2010. However, when we were the Jones County Resilience Collaborative, we were partnering with the Jones County Health Department and used them as our fiscal agent in order to write that first grant. So I think I covered everything, but if not, Mebin, what else would you like for me to share?
That's great for right now, Tamara. Thank you so much. Let's move on to Sonia Geronda.
Hello, everyone. I'm Sonia Geronda, and I'm the Executive Director at Smart Start Partnership for Children in Henderson County. We are currently in a collaborative that's called the Raising Resilience WNC group. This is a group of folks that represent the Smart Starts in 22 counties out here in the West. You'll see listed there. We decided that as a group, as a region, we wanted to do something together to address resiliency. So we looked at multiple areas in micro, macro, and meso levels to try to determine how we can make some systemic change across the region and not just in our individual counties. So we worked together to put together a funding source application, as well as determine strategies that we're going to work on that we can pick from in order to focus on resiliency in our community. As Smart Start in Henderson County is the agency that's holding the contract with the grant funding source that we currently have. We have 4 of the counties that are part of the project are in a different set as far as funding streams go, because we're still looking for funding for them as well. But right now, Dogwood Health Trust is the current funding stream. Next slide, Mevin. Right now, I'd say some big wins are that the group participated and worked together to build our capacity. Like, we spent 2 years working on our strengths and areas of opportunity to sort of work collaboratively together. Like, what does one partnership need to strengthen areas in, and who has a resilience group already started, and where are we all at? We worked to focus on those things and help each other, so we knew we could secure that funding source moving forward. We also have an extremely supportive funder. Dogwood Health Trust has been there from the beginning, showing interest, and is really flexible and adaptable to meet the needs, because they want to see this succeed. So we're really happy that they've shown that support for us for the next 3 years.
Thank you, Sonia. I think it's great that you lifted up. Some of these things take time. You know, to take 2 years to get on the same page is time well spent. And I appreciate you lifting that up. Next, Jane Morrow.
Hi, I'm Jane Morrow. I'm the Executive Director of Smart Start in New Hanover County. We're a single county task force, the Resiliency Task Force of New Hanover County. Communities and Schools serves as the sort of backbone agency. Started off as the fiduciary, sort of like you were saying, Sonia, that some grant money initially had to live somewhere, and it lived with them. We don't have one single funder that's supporting all of this work. Part of me is a little bit jealous of that. It would be nice to have a big funder support it. On the other hand, we've had multiple grants coming in and supporting the work. And so we're able to diversify our funding streams a little bit and have different pots of money to help us do different work. But it does mean we're continuing to grant write and fundraise on an ongoing basis. One of the things, I think you can go to the next slide. And this graphic is way too small to see, but I think one of the things that's a really big win for our community is the diversity of sectors that are represented in our task force. We have multiple subcommittees, birth to 8, school age, health, an arts committee, a committee that's devoted to equity and inclusion, although we try and weave that throughout all of the committees. So we've really done an amazing job of getting all kinds of different people on board. And one of the questions later on is who's not at the table yet, but we'll get to that. But we really are looking at embedding this notion of not only ACEs, but trauma-informed work, and how do we get better at serving the community. And part of that's getting better at what we look like ourselves. So the big graphic on the top is simply some self-assessments that organizations have done to sort of say, how are we doing in terms of being a trauma-informed organization? So we have 11 of 17 sectors who've taken some of these assessments, tracking the data, tracking what we're doing, seeing how we can grow. So it's wonderful. We've got a lot of first responders trained in a lot of the somatic work about whether it's CRIM or resources for resilience. County employees, every new county employee gets some training in this. So we're really, the breadth of what we're doing, I think, is what we can be most proud of at this moment.
Thank you, Jane. And last but not least, Selena Rowell.
Hello, everyone. I am Selena Rowell. I'm the Executive Director of the Columbus County Partnership for Children. We are the local Smart Start agency for our county. The counties represented in our Resilient Columbus Coalition is just Columbus County. However, I would like to acknowledge that we do reach across counties for collaboration, and that has helped our collaborative to grow. We are the backbone agency for our Resilient Columbus Collaborative, and significant funding sources are multiple. We've received funds from the Z. Smith Reynolds Foundation, United Way Cape Fear Area, the KP Reynolds Charitable Trust, as well as support from Smart Start. Next slide, Megan. I can say that as a rural county and working with the Resiliency Task Force, Coalition, Collaborative, we can acknowledge that we've had quite a few wins, but we'll just want to lift up a couple of them. An early win for us was receiving the grant from the Z. Smith Reynolds Foundation. That allowed us to hire a coordinator for the coalition. That grant covered 2 years for staffing, in which time we developed the mission and vision statements, Facebook page, brochures and handouts, and conducted monthly meetings with trainings and updates for coalition meetings members. We scheduled screenings of the resilience film and had other information sessions also sponsored. A second win, which is more recent, is that we've acquired additional grants totaling nearly $344,000 over the next 2 years to continue this work, to reach even further into our local community, to bring about awareness of adversity and child abuse and neglect, and also to promote prevention, provide trainings and workshops, working with families. And we are so excited that we're able to continue this work through this funding. Thank you.
Thank you, Selena. So as you all can see, we have a great group of panelists with really varied backgrounds and coming from different kinds of communities to talk about this topic today. And I'd like to start off with something that Selena just mentioned about a paid coordinator. So Selena, I'm going to go back to you for a little bit more information about this. You've spoken a little bit about what the coordinator did, but has it made a difference for you to have a paid coordinator? Could you talk a little bit more about that paid coordinator position? How many hours, that sort of thing?
So initially, when we received this grant, needing to realize that we needed to have someone in place who could stay on top of meetings, maintaining the mailing lists, and when we got new members or new people came on board with the agency or with the coalition, tracking that. So we wanted to know that we're increasing in numbers of members and the things that we were accomplishing. Did we get the social media set up? Did we get Instagram set up? Did we get the Facebook set up? So all of these things were very important to us, and we needed to have one person or two who were designated to keep track of that, who would also devote time exclusively to coordinating meetings of the subcommittees, planning the agendas, whenever we wanted to sign MOUs, orchestrating that, making sure they got out to people. So this was a task that needed direct supervision, someone to watch that and make sure these things happen. So it was essential that we had at least one person tasked to do that. So getting this grant really meant a lot for that particular piece. Otherwise, how could we hold it together? Every member of our coalition has their own individual jobs to do, and having someone to pull time away from what they're being paid for, because we're all volunteering on this coalition, that didn't seem to be realistic for an ask. So we were grateful that we were able to get this funding to support a coordinator, and the coordinator served part-time, about 24 hours a week, maintaining, tracking outputs, outcomes, and also internally, we require quarterly report forms from everyone that runs an activity. So that was no different. We set up outcomes, outputs, expected outcomes and outputs, and that individual were able to track those. As well as when we get to the end of this grant, we're having to produce a report to the funder. What did we do with the money? How, what was the impact? So we needed to have somebody who could track and make sure that we could deliver that. The other part of that was the funds only covered the staff time. So we're grateful that under our Smart Start systems building activity, we were able to further support this work by providing the supplies, office supplies, computer access, office space, things of that nature, to really make sure that we were able to sustain this position for the amount of the grant, the time of the grant.
Thank you, Selena. Sonia, would you be able to talk about the coordinator position with the initiative Resilient? Gosh, I wrote down earlier.
Raising Resilience WNC.
Raising Resilience WNC. Could you tell us about your coordinator position?
Right, sure, yes. We have one project manager position that is full-time that oversees the entire region, all of the partners in the 18 counties, actually 22 counties, and that's funded through the grant. And then in addition, we have also the strategies that are part of the project have coordinators as well. So we have specific program coordinators for 2 of the different initiatives that are within this and program. And then we will have a contracted evaluator to do some of the evaluation pieces. So there's actually four positions that came with this work to help us coordinate it across such a wide area.
Thank you, Sonia. And your coordinator's been in place for about 2 months, 3 months, is that right?
About 2 months, yeah.
Okay, thank you.
Mhm.
And Jane, to you on coordinator position in New Hanover.
Yeah, so Mebane knows a little bit about this, but I don't think it could have happened without a coordinator. I mean, as someone was saying, as Selena was saying, I think in particular, all of the organizations have their own jobs. They're doing their own thing. And just the reminder emails to come to a meeting, taking minutes at the meeting, shooting those minutes back out to people, having time to research grants, having time to convene people when we're doing some strategic planning. You really can't do some of this work without somebody dedicated to do that work. And you're not going to get as far if you don't have somebody. And then, well, we don't have the funding the way you were talking about, Sonia, in terms of in the same sort of levels of project managers underneath it. We now have 2 full-time people. We have somebody that's specifically looking at training and equity work, as well as sort of somebody in a director role. And even though we're trying to build the capacity within all of our organizations to promote resilience, you can't do that if you don't have the dedicated staff time to make that happen.
Thank you, Jane. And Tamara, I think you're going to bring a little different perspective on this. If you could talk with us about what's happening in your 5-county area around paid coordinators or unpaid coordinators.
Right. So I wish that we would have had a paid coordinator. I didn't really realize that we could use those Blue Cross Blue Shield grant funds to do that for the first 2 years. So it really fell on all of the volunteers. But Jones County is less than 10,000 people. So, very small community. So what I found through networking and building relationships, we were really able to build up a strong multi-sector collaborative there in Jones County, where we had, I think, over 35 people. They weren't able to join all the time because we started, of course, right before the pandemic hit. So, COVID took a lot of people out and whatnot. But since we've transitioned over and brought the Jones County Resilience Collaborative under CSAP, so it's now the CSAP Resilience Collaborative, we are very fortunate in that we have the grant funding that does pay a program coordinator. She wears many hats because she is overseeing these efforts in 5 of our counties. And she's been with us since November. So still a little bit new. We're still, getting her trained in what she needs to do. And so a lot of what happens with the Resilience Collaborative still is falling on me. But we are once again really creating more relationships. I've even asked one person to potentially co-chair with me. So I should share with our coalition, being that we are a 5-county coalition. We actually, for the substance use prevention, we have task forces in each of our counties that do this work. But whenever we decided to pull the Resilience Collaborative underneath CSAP, we decided to do that as a regional effort. So currently we have our meetings virtual, and we ask people to join from all 5 of those counties. Because one thing that we saw too before, being that Jones is such a small county, a lot of times people work in Jones and Pamlico, or Jones and Craven and Pamlico, or there was already this natural, transition to expand it to the other counties. So it's been great to have somebody in that position, but we're still not all the way there, and we're looking for other grant funding to potentially pay someone to do just this work. Because while we've always focused on the risk factors and building the protective factors that tie in with substance use, ACEs and resilience spans much broader than just substance use prevention. But still, it's been a really nice way for us to think about sustainability, have grant funding at the current time, and still continue to do this work for the next couple years.
Thanks, Tamara. I didn't know you had that position. I think the last time we talked, there wasn't a paid person. So I'm glad to know that you're moving in that direction. So that's a big question that comes up often when communities are having discussions around resilience collaboratives. Another big question that comes up has to do with backbone agencies. And the last couple of months, the Peer Connection group has spent talking about the idea of what is a backbone agency, what kinds of things does a good backbone agency do or don't do. And I'd like to spend some time talking about backbone agencies next. And let's see, I'm going to go to you first, Jane, on this one. I know that in New Hanover, it was the Smart Start screening of resilience that really was the catalyst to getting things rolling in New Hanover, yet Smart Start ended up not being the backbone agency. And I wonder if you could talk a little bit about what are some advantages of not being the backbone agency, and what are some disadvantages or challenges of not being the backbone agency from your perspective?
So one of the advantages from a very sort of selfish point of view, and I can look over at Sonia, is it's a lot of work to do that. There's a certain amount of dedication, even if you're hiring an extra part-time fiscal person or whatever, you still as an organization are taking on a certain amount of work. So have to understand that the backbone agency isn't just sort of doing a nice little favor and we'll run things through here, but it's a lot of work. I think one of the advantages from my point of view is that sort of twofold. Sort of as you said in the beginning, Evan, we're thinking about sort of cradle through end of life as a community, and not just the birth to 5. But when we're thinking about ACEs and early childhood experiences, having it in another organization and having a real broad range of sectors represented it helps me to sort of embed or think about people embedding a perspective of early childhood and how what happens in early childhood affects them, no matter what they are, if they're first responders or the justice or the arts community. So by not having it within Smart Start, it's not, oh yeah, that's Jane again talking about early childhood, but it's sort of the community as a whole is embracing the impact of early childhood. So in some ways, having it reside somewhere else, it bolsters our message about why early childhood is important. I also think you have to, pay attention to who is the backbone agency. whoever it is. And if it were Smart Start, we would probably be leaning a little more heavily on early childhood because that's who we are. And so if you have it in an organization that's involved with the school system, it might look a little bit more school age focused. If you have it embedded into a county government, you might have a more formal sort of county focus. So just understanding that that relationship between the backbone organization and all of the other people in the collaborative or coalition or task force or whatever you call it, sometimes has to be pretty explicit. Like, hey, you know, don't just keep applying for those grants you know about that serve this population, but how do we broaden it out? That kind of thing. So so it's a lot of work if you're one. In that sense, I'm glad we're not one, but it is also has to be an ongoing relationship with that backbone agency to make sure that it's fulfilling the needs and the focus of everybody that's involved in that collaborative. But it also helps broaden that early childhood perspective, I think. Indirectly or counterintuitively, I think it helps.
Interesting. Thanks, Jane. Sonia, you talked earlier about the 24 counties, and I know that for your funding that you were the one who wrote the grant, and yet you've got different agencies sort of serving as backbone agencies for the different initiatives that are part of this grant. It's kind of complicated, but I'm wondering if you could share what's happening with your initiative around how you chose who would hold which project and how you came up with how you, it's a really interesting way you all divided up that backbone role.
Yeah, sure. Well, one of the things that ended up being a plus for us was that having one agency be the backbone was that the funder could see they were a regional funder. They could see they could serve the region through not funding 18 different partnerships. They could fund one and serve all 18, so that it was appealing to them. That was one of the reasons we went that direction. But when we were looking at who has the capacity, who is willing to be the lead, who's got the structure set up and the bones set up to do that kind of thing, we were one of the ones that bubbled to the top. And but we've all probably been in a situation where you know, it's easy to say, oh well, that place has got it, they'll do it, and then you're not as engaged in the work as you were because you're not the backbone. And it's just easy to let that slip off your radar sometimes. And so in order to not have that happen as easily as it possibly could, is to have other partners in this hold components of this work. So the 4 staff I'm talking about that we hired, one is hired through us, and then we have a contract with Transylvania County, who hires a different staff member and oversees that person who does that piece of the work. And we have another one that's evaluation is with Buncombe County, and another contract with Blue Ridge Partnership to oversee a different coordinator, so that we have at least three other local partnerships that are contracted into the work. So it sort of forces the engagement, not that they wouldn't be anyway, but you know, it's just everybody's got to belly up to the bar, in other words, and to really pay attention and know what's going on, so it doesn't fall on just one entity. And so that's kind of it's really working for us so far, and it's just something that just came out of our discussions and work together. It wasn't it wasn't a revelation. It was just something we worked through and let's try this. So.
And I think that speaks to one of the things you said when you introduced yourself, was that it took 2 years, that you all spent that much time together talking through this and getting on the same page. And I know you all continue to meet monthly to talk about things. And I think communication is probably a really important part of this, to stay in touch with whoever the backbone agency is, to make sure that there's lots of communication channels to the ones who are holding that backbone.
And we've got it set up so that each county has one vote so to speak. Each local partnership has one vote. So I don't make the decisions in a vacuum. We as a group decide. And so unless it's something like an immediate, like financial crisis or something like that, where we have to make something turn around real quick, which hasn't happened yet, but we have to have an agreement amongst all of us and all have a say so in what's going on. So we don't, so we can move in unison and keep on the same page. And that's just been really helpful to have it set up that way.
Thank you. Selena, you are the backbone agency for the Columbus County Multi-Sector Initiative. Can you tell us a little bit about what that's like and what are some things that, like Jane mentioned, it's a lot of work for one thing to be the backbone for all of that, but can you give us some things that are working well and some things that maybe are challenges for you?
Well, I think I agree with both what Sonia and what Jane has said, some of what they both have offered up. It is a lot of work to be the backbone agency, but I definitely see the benefit of having one. Of course, having a backbone support organization is one of the core facets of trying to achieve collective impact, and working with multi-sectors as we do, we're trying to bring them all together for a collective impact. I can see where Jane is saying, or maybe what Sonia was saying about not being able to have everybody be the backbone. In Sonia's case, she's got more than one in her coalition. However, with us and with Jane having the one backbone in the county, some of the other agencies may say, oh, well, they'll do it. We don't have to do. And that poses a challenge when we're all needing to come together to work together. I'm not saying that we have a lot of that, but I can see that being part of a challenge. What is working well for us is that we're still coming together on a monthly basis. We're still convening this group of about 106 individuals with representation from 55 different agencies. Not that they all show up all the time, but we're consistently having the meetings and we're consistently getting participation, which means a lot, even in this climate where we've just come out of a pandemic almost. We're not out of it yet, but we're still convening the meetings and coming together and still seeking funding. And that would be the other thing. There has to be someone who or an agency that's going to agree to try to look for ways to sustain the collaborative. Everybody can bring their ideas together and see who's going to take lead on looking for the funding sources or of making the actual application. So if there's a backbone agency and the information is brought, then we can try to make that application and receive additional funding for support as well as sustainability. And who has capacity? I think that the way it landed that our agency became the backbone agency, because it seemed to be a fit that we were talking about adverse childhood experiences, but those experiences last throughout our lifetime. And so the way that we are looking at this is cradle to end of life. It's not just the children. So I'm grateful that it's not just pressed upon Columbus County Partnership for Children, because adverse childhood experiences is in what we're trying to bring about awareness of.
Thank you, Selena, for that perspective. And Tamara, along the same lines, I wanted to ask about backbone agency for CSAP, but I also was hoping you could address, does having the funding from this coming from substance abuse prevention, does that limit the scope of your work at all in terms of ACEs and resilience, or how has that provided an opportunity for you?
Good question. So I'll start back with the Jones County. So whenever we had it in Jones County only, we ran it through the health department. So they were our fiscal agent. And it was a nice fit because the person who was there as the health educator and public health educator at the time, she and I were the ones that wrote the grants. And then at the time, the health director was very supportive. And so it was helpful. I will share, in case other people are looking to partner with their local health departments, the only downside to that was that whenever we spent, we wanted to buy something that was over, I think it was $500, it had to go back before the county commissioners. So there was, a little bit of a process there. It wasn't as easy like it is now for me. Like I have a card, and if I want to buy something, I just go swipe the card. So that was a little bit different whenever we pulled it under the nonprofit. So we act as our own fiscal agent because we are an established nonprofit. And having the Drug-Free Communities grant has not limited us at all. I share out widely with people, anybody that will listen that's doing this work, connect with your local substance use prevention coalitions. And if you don't have one, think about writing for the DFC or the Drug-Free Communities Grant Program. They recognize it's run through the CDC. They manage the grant. It is a federal grant, so there is a lot of federal reporting and a lot of that you have to be able to do if you're not using a fiscal agent. However, they recognize the importance of addressing and buffering ACEs, not just stopping at childhood, though, understanding, more about adverse life experiences. So kind of take into consideration from cradle to grave, what is this looking like? Because we know for a fact that typically people who are misusing or youth initiating substance use or misusing these drugs and chemicals and alcohol, most of the time have adversity in their childhood. And unfortunately, a lot of times people who are in active drug use are constantly being re-traumatized. So we know that traumatized people use drugs, and people who use drugs tend to be re-traumatized. And so it's a natural fit, but it has not stopped us at all. It's once again, provided us with a good amount of funding to continue to do this work for the next couple years.
Great, thank you, Tamara. So the next question I'd like to pose for you all, and I'll let you all decide who wants to go first on this. What is providing the most challenge for your coalition at this time? What's your biggest dilemma? What are you working on right now? Give you a moment to think about that.
I'll go first so it's not super quiet the whole time. Although we have somebody that's raised their hand, I don't know if we want to take people's questions now. But I can share. So I think for all of us, COVID has been challenging. Virtual meetings, getting people to virtual meetings. But it's interesting because now that I'm starting to have conversations about coming back in person, now everybody's like, well, but virtual meetings are so easy. But I shared earlier with our Resilience Collaborative, we are staying virtual at least for a while until maybe we can build up our collaborative to the point where we can have one in each of our counties that are really, thriving. But one thing that we've been working really hard on is thinking about those multiple sectors. Now with DFC, we have to have 12 sectors represented. So once again, it was a nice fit for us because we already have a lot of the organizations that we would want at the table. They're very much outside of just early childhood or with children, but we do also have the Partnership for Children, and we've got our schools on board. We've got some superintendents on board. But that's what we focused on more recently, is really just building those partnerships. And that too takes time. It's required me, like, for example, Friday will be the second time that I go into the New Bern Police Department, and I'm going in and I'm talking with them at their 6 a.m. briefing and their 6 p.m. briefing to form that relationship. And to let them know who we are, what we do. And also we're bringing Becky Haas back to do some trauma-informed police training later on in the year. So really I'm going hard right now trying to develop the relationships with all of our law enforcement in each of our counties to get them to the table to just start this conversation of the need to even be trauma-informed. So I'll step back now.
Thank you. Anyone want to add to what Tamara said or share your challenges? What do you have a dilemma right now that you're thinking about?
Yes, I like to just go ahead and share my information. Of course, it hinges right on COVID and when it initially hit, it seemed like we were just getting ready to take off with our coalition and getting things in order, trying to do strategic planning. And then we were basically felt like we were just shut down. So COVID took a little wind out of our sails. It took us a minute to adjust, and through it all, though, we did not stop the regular meetings. We quickly adapted to the virtual meeting platform and continued to meet that way, even trying to really think of new ways to make sure that we were continuing on. All the time during the height of the pandemic were opportunities for us to participate in trainings and learn more about this work that we were trying to do. Also, as a result, we were able to provide the schools with a resilience day training, because the schools offered a resilience day to the teachers. And so the coordinator put together a packet of information that she was able to email out to the schools, and they were able to share with the teachers. So we found ways to make it through COVID and still continue to do the work. And also shared with the school counselors in every school counselor department, The Highway Inside of Me, which is that little booklet that was so resilience informative information inside. So we found ways to overcome what COVID was slowing us down from.
Thank you. Sonia, would you like to add anything to that?
I think one of the challenges is that we have such a large region, being 22, but yet our largest funder can only cover 18 of those. So finding the funding to support the same work in those other four counties that right now is a challenge, especially as being the lead. I'm not in that part of the state. I mean, they know their funders and their resources so much better than I do. So working together with them to try to find opportunities to go alongside with what we're doing has been our biggest challenge.
Interesting. Thank you.
I think I might add, not so much a particular dilemma or challenge right now, but something I think that we go back and forth with since the inception, is sort of who's the unit of change, who is the task force trying to change, how are we trying to change the system. And so we often, we're thinking about, are we missing families? Should we be doing this for children? Should we be doing that for parents? But we have actually, from the beginning, tried to work with the people who are providing care. So our initial main focus is the other agencies and organizations and institutions, whether it's justice or early childhood in a big picture, or first responders in a big picture, to sort of say, how can we help those agencies understand how to become more resiliency focused and trauma informed. And so that tension is always sort of there between most of us who do program work and are wanting to do those direct service things and going, oh, well, the coalition isn't going to be yet another nonprofit serving people directly, but the task force isn't necessarily serving people directly, but we're serving the people who serve people. That in essence, in a little bit like Smart Start, we do a little bit less directly with the children, but we're caring for their caregivers, we're caring for their parents and the early educators. And the task force is caring for those agencies, or educating and informing those agencies, and we're informing each other about ways that we can be better and do better through any number of policies, procedures, putting on a equity lens when we look at the work we're doing, all those things of that nature. But that's a little bit harder to do. It's a little harder to measure. It's a little harder to feel always sort of good about it and to explain to somebody else what you're doing. And you want to be able to do those direct services. And so I think that's been an underlying tension sometimes when we're doing strategic planning and trying to figure out how are we measuring our impact when we're not necessarily, we're not doing that direct service. So when the early childhood committee is putting on a conference, so it's not doing things directly with children, but it's putting on a conference for people working with early childhood community about understanding trauma and resiliency. So again, not so much a challenge, but maybe an ongoing dilemma.
Thanks, Jane. I've heard a few of you talk about developing those relationships with people within your coalition, whether they're in your system or in other systems. And I'm wondering, I think I'll start this time with Tamra. Could you talk a little bit about the importance of relationship building and how you have done that? First of all, developing friendships and relationships with people working on this together, and just your insights into some of that work, which sometimes is really hard to measure and really hard to, what's the word I'm looking for? Really hard to show the results of relationships.
Yeah, great question. So I think most of us on here know connections matter, right? And so building those relationships is really going to be key to bringing anybody to your table. You know, you might get somebody just because they have an interest and they'll join one or two meetings, but unless you really take time to develop those relationships, I haven't found that they're necessarily going to keep coming back. And one way that I do that, I'll tell you all, like I eat, breathe, and sleep resilience. I talk about it all the time. I come from a town, I live in Pollocksville, and in 2018, almost our entire town flooded from Hurricane Florence. So we all had, you know, this collective traumatic experience. You know, then now we're in this pandemic where it's this collective traumatic experience. And I almost see these as opportunities to be able to start these conversations, to help people to understand that, you know, it's not just always about bouncing back, but we can, it's my new term, bounce forward. So really thinking about bouncing forward and how can we be better than what we were before. And so it's really just been this natural fit with everything that's going on in the world the past couple of years for us to really kind of springboard all of this work and reach our community members. My background is public health. And so I know about 5 or so years ago when I first learned about ACEs, you know, it was kind of, I had the aha moment of, if we can address this, you know, think of everything else that we can mitigate along the way. And so I'm able to kind of put it into almost every conversation that I have, not necessarily the trauma piece, but the resilience piece, and really focus on chasing that resilience and finding ways that we can thrive. So if you know me, then you know I'm constantly talking about resilience. I'm constantly promoting our collaborative, the things that we're doing, and really trying to get other people to do the same, because my whole motto is that we are stronger together. And I think, you know, me being as collaborative in nature as I am, people want to continue that conversation because they also recognize that I'm not the one that's going to always need to, I don't always have to be the one, or we as an organization don't have to be the one even to lead this. You know, I really try to uplift other people's voices and the partners that we have in our community, highlight what they're doing and encourage them, you know, to do more of what they're doing to reach their sectors. Going back to what Selena has said about collective impact, you know, we're always thinking about this collective impact. And I know that I can't do everything, but yet, you know, everyone that comes to the table, everything that they're doing, all of these things add up, and how much of a difference we can make in our communities by all working together. Because I think all of us on here can agree, for so many years, and we still see sometimes people working in these silos. And so that's a lot of what I've really tried to do is break down those silos and really try to get more and more people at the table. I probably have 2, if not 3 meetings a week now, where it is just about that relationship building and having conversations around how can we collaborate? What do you need? How can I support you? What are you doing? And I make sure that I share out resources all the time.
Wow, Tamara, thank you. In terms of developing relationships, Sonia, when you first got on, I highlighted this a couple times, that it takes time to build these relationships. And, I think oftentimes people will say, well, when are we going to get on to the real work that needs to happen? And we don't value that relationship building part. I wondered if you had any of that with the resilience, Raising Resilience WNC, when it took 2 years to get up and running. Was there any pushback on this is too much time, or did people value the relationships enough to keep plugging along?
No, I think we all knew it was going to take some time to do it, and we're committed to it. I think one of the benefits of it were we were all smart starts. So when you're looking at who we're missing, we're still in the stage of it being the partnerships, and not haven't expanded out into the other relationships that we would bring on board. But that still required a level of commitment and willingness to learn each other and learn how we work together, and learn, to trust each other, and to recognize that, this group isn't in it for this, and that we're all in it for the same reason, and that we all agree on the same goals. I think that's what was key, that we worked with a consultant to sort of bring us into, what do you want to see change in your community, until we could all get to that same change, that we all wanted to see it change. And each of us are in different places in our own community. So some of us, have resiliency groups in their community, and some of us don't. Some are way further along than others. And so to identify this as something that we all wanted to do and focus on was key in building that, in those relationships, and trusting everybody and each of our roles, and that we would do those roles.
Thank you.
Mm-hmm.
Jane, I'm wondering if you could talk a little bit about the committee structure and in New Hanover, and the relationship building. You're breaking back out from the big group into small groups. Do you feel like those small groups are helpful in relationship building, or does it separate those sectors out?
No, I think it's really helpful. The entire task force, which I don't even know how many people are on it. There's a whole bunch of different organizations, and then some organizations like ours, we have multiple people within our organization that will attend the big monthly meetings. But I think what the committee structure really allows us to do is identify for one another that, we want to talk about the whole person. That whole person lives in a community, they have jobs. We're not just early childhood, or just law enforcement, or just arts, or just the mental health or substance use world. So by having all of the committees, it really reinforces that notion of this is really multi-sector work, and that people who've experienced trauma, or people that want to help people who've experienced trauma, work and live in multiple sectors. And then it's also allowed then those groups, and I don't know, the committees vary in size a little bit, to be a little bit more issues focused. And the people in there are very committed to that particular work, so that when the arts committee is meeting and saying, oh, we want this project, or the early childhood committee says we want to put on this conference. So each committee is able to do projects and bring in trainings and grow their own work in a certain way, almost like a little standalone group of committed people who are doing some work, and then it throws it back up to the steering committee or to the task force as a whole. So I think it's really been nice. It's a lot of work and coordination on the part of the coordinator, again, why you need staff, but it's been really nice to sort of have a both and, where people can really focus on the issues area, or the content area, or the work area where they live and breathe, and and that feels most relevant to them. People within the organization don't mind them going to those meetings because it really is about their work. But also through the overarching task force and the steering committee, that stuff is woven together, and we can address things sort of community-wide. So I think it's been, we've gone back and forth sometimes about should it be this committee or should it be that committee? And some of the committees are a little bit more active than others. But I think overall, it's been a really nice way to have that sort of both and. The content that's most relevant to you, but also within a larger context of, and it helped us to have a truly multi-sector task force.
Thanks. And Selena, what would you like to add to the relationship building component of building a strong coalition? What can you share with us?
I think that the relationships that each entity of the coalition brings, or how they interact with their community or their clients or whoever they're interacting with in their sectors, really adds to the strength of the collaborative. And I say that because during the pandemic, around 2020, we were able to offer some Reconnect for Resilience trainings. And I'm going to speak from the aspect of our agency, the Smart Start partnership here. Over the years, we interact with our local community. They come to know us as a trusted entity in the community. So when we were able to offer the trainings that were funded through the CARES Act, through Smart Start to us, we were able to offer that training to everybody on our coalition, everybody on our in our community that were in childcare, the teachers in the childcare facilities, parents, everybody in our community could have accessed that training. Out of that, because we've had families that have come through our agency on a regular basis, there's one that will stand out in my mind, and you guys have probably seen the stories or read or seen the documentary. But when someone comes and say that they participated in the Reconnect for Resiliency trainings, and they gained the skills that they needed after they were flooded out of their home with a child and family and were displaced for 9 months. And they trust us enough to know that what we're trying to offer to the community is helpful, it's beneficial. And then they're willing to tell their story over and over again. That spoke volumes, not to just our partnership, our agency, but the relationship that we're building and the coalition that we're building in our community to talk about resiliency, to make the resources available. And it is about relationship building. And at some point, it's also about what you can give back to your community. So I'm thankful for the relationships of our coalition, as well as what we've done with our community over the years.
Thank you, Selena. It's so important to think about not just the relationships between the staff that are in all these organizations learning to work better with one another, but also the way we create relationships with our clients and families that are coming to us for services, that those relationships are key too. And I don't know who said this, but that all healing happens in the context of relationships. And I just think that's so important that we always keep those human connections in mind when we do this work as primary. And any time spent building relationships is time well spent. So it seems really key that all 4 coalitions that we're talking about today have seen the importance of that. Selena, I'm going to go to you because there's a question for you. This was in the Q&A. How do you see the resilience work that your organization has done rolling over into other aspects of what you do?
That is such a great question. I really see the work that we've done growing and being a foundation for what we're building with some of the other programs that we've been funded for. An example is that, of course, resiliency and bringing about awareness about ACEs and trying to promote these ideas of resilience and also preventing child abuse and neglect are some of the things that we really, really believe in and have our hands in right now, I guess I'll say. I know that the funding for our coordinator is running out. How do we sustain that? How do we continue to have one person or two people keeping our coalition running? We apply for grants. And so that's what we've done. We've applied for grants. And if we had more time, I could tell you the whole story, but I'll give you the abbreviated version. We have grants that are going to be able to continue this work. Who's not at our table that we'd like to see more of are the families who are really going to be the recipients of a lot of what we do. So our grants that we've written around resiliency for children and families and communities. So those voices are going to be brought into our conversation in a mighty strong way. That's how we're going to continue to roll what we've already learned into our new projects and what we're going to be doing going forward, so that children are ready for school, they're resilient, the families understand protective factors, they understand how they can be the buffer for their child in the community and at school, how they can be the advocate that their child needs, and when they should step up and really become that person. And so we've got several projects that we're working on that we're so grateful to be funded to continue work with child abuse prevention and awareness, with resiliency, the whole 9 yards with our families in Columbus County. And all of that would be very key to our work on our Resilient Columbus Coalition. And we're so thankful that we're able to do this.
Thank you, Selena. So this is kind of a more general question for everybody, and I'll let you all decide who wants to go first on this. What would be your advice to others who might be interested in starting to convene their community members around trauma or resilience? What kind of advice can you give our folks who are listening today?
Do much better making silence for the rest of class. No, Selena, if you were going to say something, go ahead.
I was just going to jump in and say that if that's a concern in your community, just start a conversation with other people who may be thinking the same thing, and then reach out to collaboratives that are already engaged, already established, and glean from them. I know that's what we did in Columbus. We reached out to New Hanover. We kind of bugged Mebane, and she was very helpful to us, as well as some other collaboratives that were already operating. But finding out whether or not that's something that your community can move forward on and you get buy-in for. I'm so grateful also that in our community, our county commissioners are strong supporters of us. And we've got strength and commitment from leaders in our community that really care about this work.
So I will share, we have, especially in Jones County, like Jones County just signed a proclamation for June 6th through the 12th to be proclaimed as Resilient and Thriving Communities Week. And those of you that don't know about that, it is a state initiative that we've pushed forward, a governor's proclamation. And there's a phenomenal resource guide that can give you a lot of ideas in which you could use, take and run with to start having these conversations. But Mebane, I think I've heard this so many times. I did the same thing, Selena. I called Mebane, like, Mebane, you have been the stable person for a lot of us that we've come to you for advice whenever we were just starting. But my biggest advice would say, just start having the conversation with people, whether or not you're meeting at your local United Way office or a library or at a restaurant or maybe at a church, wherever. Start having these conversations, and as you start to see people coming together and just showing interest, just let that organically develop into whatever that might look like for you. And I think that once you start this work, things will fall into place, but know that there are a lot of us around the state who have been doing this work for a little while. And I'm not going to speak for everyone, but I know I would be more than willing to speak with anybody if they had any questions. I'm not going to offer you up Mebane, but Mebane was just phenomenal and gave me so much information to get started. It was very helpful. So I say just start.
I would build on what you
Be called stable, Tamara, I bet.
I built a little bit on what you said, Tamara, in terms of sort of the organically. We started some of our resilience work definitely before Hurricane Florence, but Hurricane Florence had a big impact in our community as well. And that was where the focus had to go. You know, when that happened, we were able to get in some additional partners that helped us bring other people together, made some relationships with you know, the county emergency management, which you might not have had before, got them thinking about how do we make shelters more family and child friendly, got grants to buy kits so that all of our shelters are stocked now with more child friendly cribs and toys and things of that sort. So you don't know where the work is going to need to happen. So take advantage of, look around, see where the energy is, see what's happening organically in your community, and partner with who the partners need to be in that moment. Who's in the room is who needs to be in the room with you, and be willing to shift if that's what's happening in your community, and be flexible. And you know, it's made, you know, we were able to take advantage of some of the resources that came in and forge some stronger relationships out of that.
I had forgotten about that, Jane, about sort of where the energy is. Go where the energy is, and what are people passionate about doing, because those are the things that are going to get done. Thank you for raising that up. It's a good memory. Sonia, any advice to folks that might be interested in getting started in this in their community?
I think everybody's pointed out some key points. I think the one thing that we had to do was really find out what was already happening, so that we were a big enough community that there were things happening, you know, with agencies that we aren't typically partnering with, that we're already trying to start focus on resilience. So what's going on already before we jumped into what we needed to move forward on.
That's a really great point too, that there may be somebody already doing some of this, and how can you, rather than recreating something, meld and join, rather than creating something else. Yeah, that's really important. So we talked a little bit about who's at the table and who's not. And I apologize to the panelists. This is a question that we haven't talked about, but I would love to talk a little bit about families and getting families to the table. And what are your thoughts on doing that? Has anything worked for you, or anything you'd like to highlight about bringing families in this work beyond the agencies that represent some of our systems? And I'm not going to call on anybody, because this is a new one I'm throwing at you.
I can go ahead and start with that one, Mebane. We do have a family engagement and leadership activity in which we're infusing information about not just being leaders and advocating for your families, but also about resilience, as well as a resilient and ready and resilient children grant funded activity that we've just kicked off, which brings resiliency right into the conversation with the families. And it's going to be an activity that will really put the focus on awareness, terminology, what it means to be trauma informed, explaining adverse childhood experiences, and utilizing the protective factors to help them to understand how it is that they can support their children, and the support that they can expect from people in the community or in agencies that interact with them and their children around trauma.
Thank you, Selena. Anybody else?
I think it is a voice that's missing from a lot of what we do, and something we undoubtedly need to work harder at. But I'm also always, especially after the last couple of years, trying to have in the back of my mind, we want to hear from families, and we need to hear from them in order to do work that's most relevant and important to them. We have asked a lot of parents in the last couple of years to go home, go back to work, come back, school your kids, don't school your kids. You can find childcare, you can't find childcare. I think whatever we do with family engagement, we need to really be respectful and understand the stress and most recent trauma that not only all of us, but I think parents and maybe even particularly parents of young children have really dealt with in the last little while. There's been a lot asked of families, a lot of burden that they've had to take on. And so as we try and engage them, we just need to keep that in mind, that we can't just have it as a take, like, give me your information, give me your insight, and then let me run with it. That we need to think about how to have true partners and thought leaders of families with us, not just, hey, I want to just pick your brain and then go off on my own. Not sure that we're doing that the way I would like to in my head, but it's something I think is important to keep in mind.
So I'll share a little of what we're doing in our community. We're really doing a lot of outreach and events. So kind of going off of what you were saying, instead of just asking them to come to the table and give us something, we're like, for example, on May 14th in New Bern, we're going to hold a bike rodeo. And so we've partnered with the health department in Carteret County. They have a trailer full of bikes and road signs. We'll create what we call Safety Town. And it's all just to bring our families out for a day of fun, because we know that by strengthening the family connections and the family unit and having them doing something together, is helpful and strengthening those protective factors. So we're doing a lot of things like that, movie nights in the parks, really just trying to hold events where our families are kind of the priority population in which we're trying to get to come there. And then while they're there, I've recently purchased things such as a good parenting edu-slider, which they can take home with them, or the wheel, managing your stress wheel, or there's all of these different educational materials. I've got some really cool coloring books that we're giving to families now. And so whenever they come, they might be the younger kids, if they want to take a coloring book and some crayons, they can. So just kind of thinking outside the box of how we can connect with our families. And then what I'm finding is then they're interested, because they're like, oh, this was fun. Who are you? What do you have to offer? Well, can I join? And so once again, it still, I think, goes back to building those relationships and showing, this is who we are and this is what we do and this is how we want to support you. We would love to have you. And it just opens that door. So that's one of the things that we've been doing. We've also partnered with a lot of our community partners. I know I saw Dr. Myers on here, I believe, from the Partnership for Children. And so they've been a phenomenal partner with us over there in Jones County. We've offered some Triple P parenting classes. We are also partnering with Teddy Bear Children's Advocacy out of Pitt County, because I'm also a member of Brace, which is out of Pitt County, because I teach here at ECU. And they're coming in to do some Circle of Security parenting circles for us. So really just, not that we have to do everything, but knowing what is available to strengthen our families and making sure that we're promoting that and partnering to offer those for our families, which has been really amazing to see. So
a nice way to reach them where they are. Sonia, anything to add to that?
No, I mean, I think one of our initial layers of strategy is to work with the child care providers, which their families as well, and the kids that they touch. And the first step is internally, like our own board and our own community nonprofits, building their resilience first and stepping into that ready to work with the families. And so that's where we're at the moment before we bring a child into that.
Great. Thank you, Sonia. I'm going to ask one last question. I haven't seen a whole lot of questions from the attendees, so I'm going continuing on my questions. The last one, and I know we only have about 5 minutes left, but I wondered if you all could share in any order what data, if any, you might be collecting to guide your work. Is there any of that happening in your communities?
Ours is just getting started. That's why we are hiring an evaluator. So we have a few outcomes that we're going to have for, number of heads and bodies and seats, those kinds of outputs. But we're using the evaluator to sort of drill down a little further how we can collect that region wide.
Look forward to hearing more about what happens there on your data.
We're doing less programming, so less program outcome kind of data, but we're really working hard on training the community. So we're tracking people who have been trained in what sectors, percentage of the community that's been trained. We're trying to build in some more equity focus, looking at historical racism and bring that specific kinds of training. So tracking not just the general trainings that we've been doing, but trying to understand what we're doing from that lens. And then, as I mentioned in the very, very beginning, we're asking organizations that are part of the task force to look at their own policies and practices and just tick off which ones they're doing well in terms of being trauma informed and resiliency focused, and report that on a data website so that we can really get a snapshot in the county of what sectors are strong, reach out to one another for support. So we're sort of looking at data and outcomes from the task force members and how we're growing rather than like program outcomes.
Thank you.
So for us, we, with every community resiliency model training that we do or workshop that we do a pre and post. We've done with the Resilience Symposium. We had an evaluation of that entire day, which that gave us some really good information to go with. We've got a lot of process outcomes in terms of like, how many posters or how much educational materials are we actually sharing? We're getting ready to run a whole social media, like a social marketing campaign that's coordinated across all 5 of our counties for 4 weeks, but during the week of Resilient and Thriving Communities Week, where we're going to have billboards and PSAs at the gas station pumps and things like that, all around strengthening families framework. So there's 5 protective factors, as well as I really like the HOPE framework. So healthy outcomes from positive experiences and those positive childhood experiences. But we pay an evaluator. And so part of what we do as well through the Substance Use Coalition is we have our 8th, 10th, and 12th graders in our counties take what's called the PRIDE survey, and it's really more for substance use prevention, but there are questions on there about risk and protective factors. So we've been collecting that now. They just added those a couple years ago, so we've done that once. So that was our baseline data. So we're excited to collect that data and have that analyzed again this year to be able to compare to see where we're moving. And then our hope and our goal is, of course, to increase those protective factors and reduce those risk factors. So those are a couple of the ways that we're evaluating what we're doing.
Super. And Selena, you're the final answerer for the whole session. What are you all doing around data?
Well, for now, we're just tracking the number of participants in our resiliency movie screenings and how many participants have participated in the Resilient Day at the schools, and just numbers for now. But we're looking forward to our data tool being launched from PACES Connection and be able to track what our partners are doing with regards to the activities and how far they're reaching into their communities. So we're excited about that coming up.
Great. Well, thank you all so much for sharing. There's so much in common, but there's a whole different flavor to the way it's being done across the state. And I'm grateful that you all shared this time with us. And for the folks who are attending, thank you for being here. And if this is the kind of conversation we have at our monthly peer connection group that meets on the 3rd Wednesday of the month, It's for an hour and a half. And if anyone who's attending this panel session is interested in learning more about that peer connection for North Carolina folks working on resilience and ACEs, please feel free to email me. And Jessica or Mary, I don't know if you all are able to put my email there. You're so quick, Jessica. If anybody is interested in joining that peer connection, you can come once a year, you can come monthly. There's no pressure on that, but it's a place where we have conversations like this. So please feel free to email me if you'd like to receive invitations to those events. And thank you again for joining us today.
Thank you all so much. I'd like to point out that we have a few surveys in the chat that Mary just popped in. Thank you, Mary. There's a survey for each day of the conference, so we would appreciate you providing your feedback. Additionally, I want to lift up that we do have a raffle winner for this session, and the raffle for this session is actually a $100 gift card from Kaplan Early Learning, and the winner is Nikki Parker. So Nikki, congratulations. We will be reaching out via email. You can also reach out at conference@smartstart.org, and we just want to make sure we can get your information to give you that gift card. So congratulations, and thank you for everyone in attendance for your engagement, and for all our panelists for all the wonderful work that you do. And thank you, Mevin, for moderating.
My pleasure.